and welcome back to my channel. In this video we're going to talk about my top tips for postpartum cesarean birth recovery. So if this is your first time being here, or if you've been here for previous videos, just as a little reminder, my name is Kitty Hackle. I am a registered general nurse. I'm also a birth and postpartum doula, a lactation consultant, an antenatal educator and hypnobirthing instructor. I am a mum to two little boys, one of whom has joined me here today, and this is little Archer. I've also got Atticus, and I'm a bonus mama to Jess. And over here on this channel we talk about everything from trying to conceive to achieving your dream birth to postpartum and breastfeeding or chest feeding. So if that's the sort of content that you are interested in, I would love to have you over here. Let's dive straight into the video. So my tip number one is to prepare for that normal postpartum vaginal bleeding that we call lochia. And yes, even though you have not gone on to have a vaginal delivery, you will still have this normal lochia for between 2 to 6 weeks postpartum. So make sure you have a pack of your maternity pads, if not two at the ready. Some women prefer to have, particularly post-cesarean birth, those Tenna pads or adult diapers because they can go up over your incision site. So that might be something that's worthwhile considering. But also making sure that you are aware of what's normal and what's not can be really beneficial. So what's normal? What's normal is making sure that you are looking at the color, the odor and the consistency, as well as the amount. So first things first is the color. Your color should be very typical of a period. So from fresh bleeding to sort of slowly becoming browner in color. If the blood is looking in any way yellow or green tinge, that can be an indication of infection. And indeed, if that is paired with a malodor, so if it smells a little bit funny, or if you notice you have a temperature or feeling any way feverish, you'll be letting your care provider know immediately. When it comes to the amount, you should not be going through a pad per hour. So simply changing your pad out every time that you go to the toilet should be more than sufficient. Equally, if you're passing any kind of clots, you would be letting your care provider know immediately. The next thing is to be aware and be prepared for the incision or site pain that you will feel. As well as the site itself, you may also feel a lot of pain and discomfort inside your belly. That's because a lot of maneuvering around has been done during your surgery to make sure your baby has safely gotten from inside your body to outside your body. So being aware and being prepared for that, having the medication ready at home for pain relief, if that's the way that you choose to go, is really important. Your care provider will be able to let you know what sort of medication is safe for you and your baby if you are breastfeeding your baby, and making sure that you have that ready at home for you is going to be really beneficial. Equally, when we talk about that pain, you want to be doing things that are going to support movement postpartum. So whether you are talking about coughing or sneezing, you want to be and indeed laughing actually, and making sure that you have something to create a little bit of counter pressure against your abdomen can be really, really lovely. So that might be having a little pillow or a cushion nearby so that you can sort of brace the site and put a little bit of counter pressure before that movement happens to make it a little bit more comfortable for you. When it comes to movement, it's also really important to do. So it might not be huge movements, but little ankle circles, just pointing your toes and flexing your feet can be really good, as well as getting up and doing a little gentle walk, even if it's just around your hospital room, can be really beneficial to reduce the likelihood of you developing any DVT or any clots. So making sure that you get moving as soon as is possible for you is really important. The next thing is to be prepared for breastfeeding your baby after cesarean birth. So yes, you absolutely can breastfeed after cesarean. It's one of the biggest questions I get asked. However, there are a few things that you can do to prepare, because for some, what happens is your body can take a little while just to figure out the fact that your baby is in fact earthside, and your body has to go on to prepare the milk to feed your baby. So for some women, that can be between 7 to 10 days post cesarean birth. But the few things that you can do to help that process move along is to feed your baby soon, efficiently, and often. So we're talking about making sure your baby goes to the breast for their first feed, ideally within the first hour after birth. Some hospitals are a little bit more open to this than others, so you may indeed be able to have your baby go to the breast while you're still being stitched up in some cases, whereas in other hospitals, particularly more general settings, you might have to wait a little bit for your baby to be able to come to you once you're in the recovery setting. So making sure you talk to your care provider before your baby arrives can be really beneficial, or indeed writing out a feeding plan or your birth preferences and then adding that in as a part of what your wishes are regarding feeding your baby. So that's talking about feeding your baby as soon as possible. The next thing is about feeding your baby really efficiently. So when I'm talking about this, I'm talking about your baby being really well latched at the breast. So good feeding attachment and attachment at the breast is imperative. That means that your baby's got a really big mouthful of breast tissue, and that when your baby is latched on, their chin is nice and snuggled into the breast, both cheeks should be touching, and their little nostrils should be free. What we know as an asymmetric latch will mean that you should be able to see less of that darker areola where the chin meets the breast, and a little bit more of that darker area where the nose is. So knowing that and seeing your baby swallowing regularly at the breast for about 80% of their time at the breast means that your baby's really well attached. So good attachment and going to the breast nice and early. The last one is making sure they're feeding really often. Your baby should have a really active hour after birth. We want to make the most of that. But sometimes the remaining kind of day after birth can be a little bit sleepy. We want our babies to be feeding a minimum of between 10 and 12 times in a 24-hour period. So if your baby is not waking at least every 3 hours, you should be prompting them and stimulating them to go to the breast within that time period. If you're having difficulty with your baby's feeding, make sure and touch base with either your hospital's lactation consultant or your local lactation consultant, or indeed me if I'm free and available. Please feel free to contact me. I would be delighted to help you. So now that we've talked about getting breastfeeding off to the best start, we want to be able to make sure that that is comfortable for you. So what we're talking about there is not only nipple comfort, but also avoiding and creating kind of, I suppose, an environment and scenario where you can protect your incision or wound site. So for that, we're talking about positions that you can have a little bit more control over your body and your baby. I love the rugby hold for this, where you can have pillows stacked up beside you and you're supporting your baby below ear level so they can tip their head back to get a nice big mouthful of the breast, and then you're bringing baby to the breast and not the other way around. It also offers you that free hand, so you can do a little bit of breast shaping as well, which can make sure that your baby's getting a nice big mouthful of the breast so that the nipple shoots back to that nice soft palate that you'll feel with your tongue if you push it to the back of your mouth. That's where you want your nipple to be, for it to be comfortable for you and for your baby to get as much bang for their buck at the breast. You want to make it nice and easy for them. The next thing then that might be really beneficial for you would be using a little bit of either a pillow or a rolled up towel over your incision site if you were to go into a side-lying feeding position. So in this position, you're able to completely rest your body. You should have your baby snuggled into you, so you have your baby side-lying and rolled right over so that they are tummy to mummy and that they're approaching the breast from a sort of chin to the breast first, and the nipple should be pointing up the nostrils. So you're thinking chin to skin, nose to nipple. That way you know your baby's going to get a nice big mouthful of breast tissue, but having that little rolled up towel or a pillow over your incision site can mean that it's a lot more comfortable for you in case your baby were to do a little kick. I'll do my best to insert a little image here of me demoing that position for you, but any position whereby mum is going to be able to get more rest and have a better recovery is always going to. The next thing is site recovery or site management. So when we talk about basic wound management, we're talking about making sure that your wound is clean and free from infection. So things you want to be looking out for that might show you've got a little bit of an infection brewing might be redness, swelling, or oozing from the site. You should be keeping your site and incision site nice and clean and dry. No soaps or perfumes are necessary, simply letting the shower water run over the site and patting dry. A clean maternity pad is a really lovely way to do that, so that you can make sure that you're being really gentle with it and making sure that you are keeping the site free from any kind of fluff or cotton wool, anything that might adhere to the site itself. Depending on whether or not you have staples or stitches in place, they might be dissolvable by themselves or they might have to be removed by your care provider, but make sure and clarify this with your care provider before you leave the hospital. The next thing, and also this is something for those of you who go on to have a vaginal delivery, is to mind your stools, your bowels. And the first time you go to the toilet after birth can be a little bit weird. So the best thing that you can do is to make sure that it is easier in your system by making sure that your stool is nice and soft. So lots of fluids, lots of fibre, and taking either a stool softener prescribed by your care provider or just a glass of prune juice per day. I actually love to mix it with warm water, so 50% warm water, 50% prune juice, and what that does is it really softens the stool so that it's going to be a lot easier on your system. Another thing that you can do, as well as sort of gently moving so that gravity is going to be working in your favour, is to make sure that you are going with that natural urge to go. So you want to be reducing the likelihood of you doing any straining while you're on the toilet. So for the most of us, we will have that reflex to evacuate our bowels about a half an hour after our first meal. So waiting for that time, for that natural urge to go, is going to make it a lot gentler and easier on your system, as opposed to placing any extra pressure on our pelvic floor and any extra pressure on our abdomen or our incision site when we're going to that first bowel move. So my last and final tip when it comes to cesarean birth recovery is to get support. So whether that is in the form of family and friends, whether it's in preparing a meal tray and getting a meal delivery service, whether that is getting a cleaner for the first few weeks, or whether that is simply just hiring a postpartum doula to come and help you out with those daily chores, making sure that you are able to get into bed, recover, listen to your body, eat nutritious foods that are going to be medicine for your body instead of poison, doing gentle exercise when your body is ready, as opposed to lifting anything heavier than the weight of your baby in those first few weeks, means that you're going to have a positive and empowering postpartum recovery experience. So that is all for this video. I hope you found some of those tips helpful, and make sure and hit that little subscribe button down below and join me for the next video soon.